Hi, I've heard that there's embedded social workers now at Fort Bragg. They call it embedded behavioral health care workers, and I'm really excited because my husband and I have really been wanting some couples counseling, but now we're told we have to wait until they're set up in clinics, which is kind of like what already exists on Fort Bragg, and we're kind of concerned about security clearance, confidentiality. My husband's really private, and we'd like to be able to work with somebody, but without it all being documented. So I'd like to know what's happening with these new embedded behavioral health social workers. Thanks.
Yeah, thanks, Gene. So I'm trying to see if I've got the number of social workers, but this was, this was a big issue, and I will tell you from, again, my time at JSOC, we had a magnificent social worker there, and she was frankly one of the busiest folks we had in the headquarters. And I found, the value of the social worker. My expectation of what a social worker did and really what our social worker did were two different things. And she was fabulous, marriage counseling, all those sorts of things that Gene, you laid out. So the reason you probably haven't seen them yet is because we just let this contract. So the social workers and all the other behavioral health specialists are just now beginning to kind of come into the various units. So there will be a little bit of a lag time, if you will. They've got to find office spaces, but there won't be any intent to create barriers around your access to them. One of the reasons our social worker was so successful is because, as the JSOC folks know there, the annex is kind of off the compound so that people could kind of freely come in, and that was crucial. So one of the things that I have recommended to all the units is put your social workers and others in a position where you'll have free access without having to go through a lot of security checks. Now, in terms of documentation and the privacy, again, that is become between you and the social worker. The social worker has, again, she is governed by certain, or the social worker is governed by certain policies and rules and laws that your confidentiality is protected. So I don't think you have to worry about the privacy issue when it comes to you and your husband talking to a social worker. What I'd ask is give us a little bit of time because...
Well, I was going to say the POTIF rep at your husband's command would know when the people are in place.
That's a good point.
Yes, and so you could check with them because they will know the status of that.